Eyebrow transplant. How soon will cobblestones appear? On January 17, 2013, I underwent an eyebrow transplant procedure. I received 300 grafts per brow, and most of the crusting is gone. What I am noticing now is small bumps on my right eyebrow at the graft site. I'm still itchy and tender in the area. My left brow doesn't feel the smoothest, but I don't see bumps anywhere. The bumps are located at the beginning of the right brow, and I don't see them anywhere else on the brow. I hope it's simply part of the process and will smooth out.
Thank you for your question. So you underwent eyebrow transplant and you got approximately 300 hairs per brow, and you're describing some cobblestones and bumps, and you've expressed a concern. Well, first of all, I think it's very important that you actually speak to your operating surgeon about these bumps and understand if the doctor is at all concerned. I'll share with you my approach to eyebrow transplant and what these bumps mean when patients come and see me for my procedures. First of all, eyebrow transplants involves a technically different style of procedure than is typical hair transplants on the scalp. These eyebrow hairs have to be placed at an angle, and they have to be placed in a very fine way so that there isn't much tissue around the hairs. Imagine when you're putting 300 hairs, and typically you can have anywhere, depending on the volume of hairs, you can have 100 to 200 hairs placed in a very small space. So what I do in my practice when I do eyebrow transplant is I use a material called extracellular matrix. And this material is for wound healing. Now, I've been using this same material to reverse or to treat male pattern and female pattern hair loss as an injection. And what I do when I do an eyebrow transplant is I actually use the same material in an injection form as well as part of the healing process, so that it accelerates the healing so that the hairs take a little bit faster. And something to understand is that when you have any transplant and the hairs are close together, or the hairs are being placed close next to existing hairs, well, there's a chance for trauma or injury to the existing hairs. So what I've found in my practice since using the extracellular matrix is that the amount of shock loss or loss of hair soon after surgery, or as well as collateral hair loss, has diminished considerably. In fact, we're actually seeing thickness in the eyebrows such that the hairs that were thinning, and in many people who come for transplant for the eyebrows, it's because their eyebrow hairs are thinning. And so they find that those hairs that are existing start getting thicker. But to answer the question about the bumps and the cobblestones, sometimes the bumps are related to the size of the graft and the size of the hole, the size of the slit. So when the transplant is done, if there's a certain amount of skin around the graft and it's placed into a hole that's a little bit smaller, then sometimes you can get a bump. The other times that some bumps can occur that can be a little bit different than is typically normal is if there is a second hair under the skin after the hair was transplanted. So when the transplant is being done and you're placing the hairs, then and you look and you see and you think that maybe that same slit doesn't have a hair in it, you can be putting a hair on top of the other. It's sometimes referred to as stacking. So in the end, these bumps have a natural course of just getting softer and smoother. And then the most common cause is just normal healing. In the beginning, early stages of the healing process, there's something where the body generates a little bit more collagen or healing material, and areas can get bumpy. We find this in almost any surgery that we do. We can, anything from upper eyelid surgery to facelifting surgery, initially the skin can look a little bit bumpy, and then with maturation, it will soften up. So I think most likely if your doctor is an experienced hair transplant specialist, then most likely these bumps are just normal and that you just have to wait it out. Proper wound healing for any surgery, although generally we say it's about 6 months, is closer to a year when you think of it technically from a wound healing scientific perspective. So again, to summarize, speak to your doctor and follow any kind of advice or concerns that your doctor has. If any of these hairs turned out to be maybe ingrown hairs or buried hairs, a lot of times the body just kind of breaks it up and it goes away, and sometimes they have to be just unroofed and cleaned up. So, and I hope you learned a little bit about the extracellular matrix concept that we're using in wound healing and for hair restoration. So I hope that was helpful, and thank you for your question.